Hello, everyone. My name is Amol Nirgudkar. I'm the CEO of Patient Prism, and I'm here at the Women in DSO conference at the ARIA in Las Vegas. I'm here with my good friend, VanceTaylor, who is the Chief Growth Officer at Vyne. Tell us a little bit about what Vyne is doing right now in the dental space and how it's impacting everything.
Yeah, so Vyne Dental has a pretty clear mission. I think like many businesses, at a high level, we seek to reduce the unnecessary cost that's inherent in our business, in the workflows, the support, the business of delivering oral health care, right? And in our domain specifically, that speaks to revenue cycle and the process of collecting the money tied to the production that the practices generate. And so in that domain specifically, there's all sorts of friction from the point of patient intake until that production is captured and the revenue is collected. There are so many breakpoints between the practice management, creation and maintenance of the data, to the submission of the transactions themselves, claims to payers, billing statements to patients, et cetera, and then getting that money back in. And all of that burden, where friction in technology or workflow manifests itself, the burden has to be absorbed by a human being. Those human beings are largely the dental billers and or office managers within the practices. And so we're building technology for them. So we're really singularly focused on building technology that eliminates the pain and the friction for those individuals who are responsible for that outcome to the business every single day, the outcome of revenue coming in, right? That's their job. And so it's really clear. And what's exciting for me is I know what we're doing and I know why we're doing. Okay. So you've seen our tagline, Billing Without Boundaries. That's what that means. We're building platform technologies for dental billers to liberate them from the confines of what would otherwise be their practice management system or other tools that they're using to do their job, but aren't designed for their job, if that makes sense.
So a typical practice or a dental support organization, let's say they sign up for your service. Mm-hmm. In 3 months of using your platform, what do they start noticing?
Right. So how do we accomplish the things that we claim? So the areas where the friction gets removed most earliest and most recognizably is within the amount of time and the number of times these individuals have to call the payer to get information or to track something down. Because we are an end-to-end system, what that means is the software that the dental biller uses to create and manage their claims, right, the clearinghouse that then that takes those claim transactions, bundles up the data and sends it to the appropriate payers, and the technology that sends the response back to the practice, that's all us. So it's a singular end-to-end loop. That's really important because they're not calling the practice management system to figure out what's going on, and then the payer to try to figure out what's going on. Right. And in the middle, there's a clearinghouse that they don't even know exists and that they can't call. So we solve that problem. So right off the bat, we drastically reduce the number of phone calls these individuals have to make to figure out what happened, right? Why a claim has aged out. Right. We can tell them why, and they just call our claims help desk, and we can answer that question. So that right off the bat removes a ton of friction.
So number one, it automates a whole bunch of things, and it reduces the amount of time the people at the office or the DSO support center are spending in doing these manual activities that take up time away from patient care.
That's right.
Right. So that's one benefit right off the bat. Do you also affect the ability to collect the revenue faster?
Yeah, that has a real impact. So that has an impact on the speed to collect because there are less required touch points and human interference along the journey, right, and so that inherently speeds it up. But a greater impact on the speed to reimbursement is things like our automated eligibility verification of insurance and benefits, because that tool will go out and confirm that the patient is actually on the plan that you have on file.
Right.
The number one reason a claim gets rejected is because you've got the wrong plan on file, by far.
I see.
And especially today, I think I just read last month we had 4 million more job changes in this country. In November we had 5 million. These numbers are unprecedented. And right, what that means for these dental practices, which they're all should by now at least be painfully aware of, is that the majority of their patients coming back into the practice have the wrong plan on file. If they submit to insurance without correcting that claim will reject. And when it rejects, from there, from the point of rejection to getting it ultimately paid by the right payer is going to take longer than it would have if it had been right in the first place. And you're already delayed by a couple weeks. So it has a massive impact on cash flow, patient experience, the whole thing gets really super messy. It's an easy thing to mitigate. You just have to have a technology sitting in the middle that's going to say, you know, I'm going to just go make sure that what you think the patient who you think is covering the patient is actually covering the patient. And then if not, we'll go figure out who it is and get that corrected.
I mean, there's so much. I mean, this could be a whole day discussion on how to really remove all this friction from activities that really don't add value to the patient. And if we're really talking about an industry that changes people's lives, then we need to stop doing all the paperwork ourselves at the office. Stop keeping our front offices and back offices busy with doing stuff that has no value to the patient. And this is what technology is enabling all this whole industry to grow by leaps and bounds. I can imagine if an economist was hired from Harvard or MIT or whatever it is to figure out the amount of money that is not collected or wasted because of improperly handled insurance situations. It could be tens of billions of dollars.
It's staggering. It really is. And to your point, you know, I'm really glad you said that, because a lot of people have kind of looked a little sideways, like, why did Vyne acquire Opera last year? That was one of our big acquisitions last year, one of 3. And because it's an engagement platform in essence, and we're a revenue cycle platform. But we actually have had a very similar thought. We believe that the patient, like revenue cycle collections, begin at patient intake. Because without that, there's no production. Without that, there's no collections. And so we wanted to zoom out a little bit and get technology in there that's going to ensure that the patient experience along this journey is also improved. And it does make a big difference. So right now we're because we have the eligibility and verification of insurance currently, and now we have a communication platform with Rails to text and email patients on. Now we have a system that and we're building this integration now. We'll be able to check your practice management schedule, verify the patients that are booked for insurance coverage.
Amazing.
If they're not covered, text the patient with an electronic form to update that information, recheck with the new information, confirm that they are in fact on that plan. And now when that patient comes in, all that potential risk has been mitigated, and you didn't pay a single person to get involved in that work stream.
And you've saved time.
Money, patient experience, all of the things that we care about.
I mean, the amount, I wish you guys eventually do a study on this, because the impact is not just revenue. The impact is, revenue is the impact, but you're going to get that from more time with the patient is directly correlated with how much case acceptance will happen in that office.
Yeah.
And employee morale and the amount of stress that now I see across the offices where they are so inundated with insurance, spending sometimes 2.5, 3 hours a day just talking to insurance companies, verifying insurance, figuring out claims, and then if that gets rejected, then it's even more.
Yeah.
And people don't calculate the economic value of that
at
all, because you don't know how to measure it.
Yeah.
People think those costs are not incurring.
Yeah.
And the costs are not just costs that you pay somebody, but the costs are the foregone revenue that you're not going to collect. So I'm excited about this, and I'm excited about this whole industry that's really creating these innovative solutions to save time and really move our industry to be more efficient and in just collecting. I mean, I think insurance, I believe there's billions and billions of dollars that just don't get collected because we just don't know what to do.
Yeah, and I think if that's spot on, and I think it's easy to say, well, this advancement in technology or this area of focus doesn't really affect the patient experience, but I like to remind people, if you've never sat on hold with Aetna, then I would ask you, if you understand what I'm saying when I say that, do you want the person that just sat on hold for 45 minutes trying to fix an issue they've been working on for weeks with an insurance payer to be the very first person that greets your shiny new patient when they walk in the door?
Absolutely not.
But that's what's happening in thousands of practices across the country, and so we think we can fix that.
So I think what Vyne Dental is doing is really allowing you to better serve your patient. It's really improving your customer journey. It's making sure that you have the time to spend with the patient, earning their trust and getting them to optimal health. That's what it's all about. It's really not about RCM. It's not about any of the jargon. It's really about elevating the patient experience. It really is.
Yeah.
And that's what makes a difference. Technology is only as good as much as it elevates us to be better at serving the people that we want to serve, which is our patients. So thank you so much for this interview, man.
Thank you.
I'm excited, and I'm excited to see you guys grow and see the impact you make on this industry.
It's always good to see you, my friend. Thank you.
Pleasure.
Yeah,
Pleasure.
Thanks.